If you're a man over 65 and you've ever felt deep down that there are questions about your health you've been too afraid to ask, questions that have stayed silent for years, then I want you to do one thing before we continue. Pause. Take this moment for yourself. Listen slowly. Listen without shame. Listen with an open heart and an open mind. What I'm about to share isn't a hype-filled promise or just my opinion. It's the result of decades of medical experience, solid scientific research, and above all real stories from men who came to this stage of life believing it was all behind them, only to discover there's still so much life left to live. Many men, once they reach 65, 70 or older, start feeling like their bodies no longer belong to them. They convince themselves that asking certain questions is pointless. They feel talking about sexuality, desire, or pleasure is embarrassing, childish, or shameful. They believe that chapter of life is over. But let me be absolutely clear. Your body doesn't stop being human as you age. Your mind is still alive. Your need for well-being, connection, and dignity hasn't disappeared. A few weeks ago, Mr. Manuel, a 72-year-old man, came to my office. He walked slowly, shoulders slouched, avoiding my eyes. He sat in the waiting room, stood up, then sat down again. When he finally came in, he stayed silent for a long moment. Then he took a deep breath and said, "Doctor, there's something I need to ask, but I'm really embarrassed. Believe me, this is far from unusual. I've seen it hundreds of times. It reflects an entire generation taught to stay quiet, to suppress feelings, to feel guilty about what is completely human. I'm Dr. Sofia Ramirez. For over 25 years, I've worked with men in what many call old age, but I prefer to call it the stage of awareness, experience, and truth. And one thing I've learned is that silence harms far more than a lack of information ever could." Mr. Manuel's question was simple, honest, and deeply human. "Doctor, at my age, is it still normal to have intimate moments with myself?" After asking, he lowered his gaze, expecting judgment, a lecture, or confirmation of his fears. Instead, what he received was understanding. We live in a society that easily accepts men having problems with blood pressure, sugar, or heart issues, but suddenly becomes uncomfortable when the topic turns to desire, pleasure, or sexuality after 65. As if desire has an expiration date, as if feeling is somehow forbidden, as if pleasure isn't part of health. Modern science and your body disagree. When we talk about sexual health after 65, it's about much more than pleasure. It's about blood circulation, neurological function, hormonal balance, disease prevention, mental health, and overall quality of life. Think of your body as an incredible machine that's been running for more than 6 decades. It has endured stress, long workdays, family responsibilities, losses, financial pressures, and countless changes. Like any valuable machine, it needs maintenance. One of the most neglected forms of maintenance? Sexual health. One of my patients, Mr. Roberto, said something I'll never forget. "Doctor, it's like an old car. If you never start it, the inside deteriorates." He was right. A Harvard study followed more than 30,000 men over several years. The results were remarkable. Men who maintained regular sexual activity, including masturbation, had up to a 33% lower risk of developing prostate cancer. 33%. That's not a small difference. It's the difference between prevention and risk, between living in fear and living informed. When I shared this with Mr. Manuel, his eyes widened in surprise. "But doctor, I always heard that was bad for the prostate." That's one of the most harmful myths. We now know that regular ejaculation helps keep prostate ducts clear, removing substances that, if left too long, can become inflammatory or even cancerous. It's not punishment. It's a natural protective function. Then he asked the question many men wonder about. "And what are the real benefits, doctor?" Let me explain, each one matters. First, penis health. Each erection brings oxygen-rich blood to internal tissues, keeping them healthy, elastic, and sensitive. Without regular stimulation, tissues lose strength and responsiveness. Second, prostate protection. Regular ejaculation clears the ducts, preventing harmful buildup. It doesn't matter if it's with a partner or alone. Third, pelvic floor strength. These muscles control urination and provide stability. Orgasms naturally exercise them. Mr. Carlos, after prostate surgery, regained remarkable urinary control through regular sexual activity. Fourth, heart health. Orgasms lower cortisol, the stress hormone, reducing blood pressure, improving circulation, and protecting the heart. 5th, emotional well-being. Dopamine, oxytocin, endorphins, and serotonin are released, creating calm, pleasure, connection, and reducing anxiety and depression. 6th, early detection. Touching yourself allows you to know what's normal. Mr. Fernando discovered a small lump during these moments, leading to early diagnosis and treatment. 7th, better sleep. Prolactin released after orgasm promotes deep, restorative rest. 8th, reconnecting with your body. Accepting your sexuality is accepting your humanity. Your body becomes an ally, not an enemy. 9th, control and awareness of sexual responses. This reduces anxiety and builds confidence. 10th, maintaining desire. Desire starts in the mind. If neglected, it fades. If nurtured, it remains. As a doctor, I must emphasize balance. Too much of anything can be harmful. Listen to your body and remember, masturbation is not a replacement for medical checkups, tests, or consultations. Mr. Manuel left my office transformed. Lighter, more at ease, not because of expensive medications but because the burden of guilt had been lifted. I gave him permission to care for himself without shame. Over time, I've seen similar transformations in many patients. Mr. Miguel regained the spark in his eyes. Mr. Roberto started traveling again. Mr. Fernando remains healthy thanks to early detection. Each of them made the same choice. They informed themselves and left the myths behind. Now I want to ask you directly. Will you continue living in fear and silence, or will you choose knowledge, self-care, and empowerment? Life doesn't end at 65. A new chapter begins, one of awareness, honesty, and presence. Your body is still yours. Your well-being still matters. Caring for your sexual health is telling yourself without shame, I'm still here. I still feel. I'm still alive. Your health, your dignity, and your pleasure matter. These years are precious, and they deserve to be lived fully, consciously, and with respect. And remember, nurturing your sexuality is more than moments of pleasure. It's part of overall vitality. It's about staying confident, connected, and active in all areas of life. Incorporating movement, healthy nutrition, social engagement, and self-care enhances your energy and longevity. It's a holistic approach, mind, body, and spirit. You have the right to feel alive, to enjoy connection, and to honor yourself fully every day. Your age is not a limit. It's an invitation to live intentionally, with awareness and joy.